Osteoid osteoma is a painful benign condition with a classical night pain which is relieved on NSAIDs, and it has a very characteristic radiological feature. The goals of this procedure include to remove the entire nidus with minimal resection of the surrounding normal bone. Amongst the various modalities available, two mainly used ones are CT guided RFA and CT guided drill resection. The aim of the study was to document the results of CT guided drill resection as against RFA in terms of efficacy, that is primary cure rate, safety, complications, recurrence rate and cost. So it was a retrospective study conducted by two pediatric orthopedic surgeons from March 2014 to December 2022. The average duration of symptoms was 6.8 months. CT scan was the most commonly used investigation. So all the patients were evaluated for preoperative coagulation profile, and patients were given the choice to decide which hospital they want to get operated in. Under a suitable anesthesia, that's a regional or a sedation, the patient was securely strapped to ensure a smooth sliding in and out of the gantry. This is a custom made marker which helps in localizing. So step 1 is a marker cut is given. Step 2, it helps in planning at what depth you want to go in and what depth you want to drill. So that's the guide wire placement. You place and mark the path. Step 3 is drill with copious normal saline irrigation. So exact depth is getting drilled. And step 4, the final confirmation. The histopath sample collection in the bone debris in the flutes of the drill was sent and stitch was given. So admission was done overnight, routine analgesics. For lower limb partial weight bearing as per pain tolerance, and weekly follow-up, suture removal at 2 weeks and follow-up at about 10 to 12 weeks interval for both clinically and radiologically. Coming to the results, there were 10 girls and 14 boys. The age group was 4 years to 18 years. Most common site was proximal femur, the least common was humerus. So we had a mean follow-up of 15.3 months. The night pain relief occurred within 2 to 3 days of the procedure, and functional recovery averaged 2.5 weeks. All 24 patients had symptomatic relief. There was no recurrence. One patient had a fractured tibia from fall from stairs at school, which healed with conservative management. We could get about 17 confirmatory results in histopath. So these are some cases. A proximal femur lesion, that's the immediate post-op and a 4 years follow-up. A 4.2-year-old boy with a distal femur lesion with a 3-year follow-up. A 9-year-old boy with tibia, which went into a fracture incidence which healed with any consequences. So we compared our studies with these two landmark articles. Both are Indian studies, and we found that the sample size was quite big but was comparable. We had follow-up average matching, and they had incidences of a couple of recurrences and couple of RFA pad burns, which in our series was not there. We compared our results with the Indian study. The number of patients were comparable. We had comparable follow-up, and recovery was there also comparable, and we did not have any recurrence. And obviously compared to RFA, the cost estimates were very less in this procedure. So we had limitations. It was a retrospective study, small number but comparable. Cases of appendicular skeletal, that is no spine case was there, and all cases were primary, and we had relatively short-term follow-up. So the aim was to document the results of CT guided drill resection as against RFA in terms of efficacy. Yes, primary cure rate was comparable. Safety, yes. Complications, no. There was no recurrence, and it was a cost effective. So to conclude, CT guided drill resection still can be counted upon as against RFA for osteoid osteoma excision. Thank you.